Julie in Manchester had a conversation with Congressman Buddy Carter of Georgia. He's the chair of the House Energy and Commerce Subcommittee on Health. He had some constituent work back home, so unable to be with us in person, but we do have this conversation that was recorded. You can watch in the monitors.
Congressman Carter, thank you so much for joining us today. I want to jump into your role as chairman of the Energy and Commerce Subcommittee on Health. Obviously, it plays a big role in shaping healthcare policy and legislation. What are the committee's priorities so far?
The committee's priorities are basically to help Americans live a healthier and longer lives. We want to improve our healthcare system. We're trying to work hand in hand with President Trump and with HHS Secretary Kennedy to see what we can do to make things better in our healthcare system. And certainly that's important. As a practicing healthcare professional, a pharmacist by profession, healthcare is extremely important to me, and the delivery of healthcare. I often say that whenever we talk about healthcare, it doesn't matter if you're Republican, a Democrat, or independent. We all want the same thing. We want accessible, affordable, quality healthcare, and that's what we want to try to deliver on the subcommittee.
Speaking of Secretary Kennedy, we know that President Trump and Secretary Kennedy have established the Make America Healthy Again Commission, also known as MAHA. We know that they are focused on addressing chronic diseases, increasing price transparency, and ensuring affordable health care. So where does the subcommittee you chair, where does that fall into this commission? How are you guys working together?
We're working together. In fact, trying to make sure that we are having price transparency and to make sure that we are lowering drug costs and healthcare costs in general. There are a number of issues. One that I'm passionate about is PBM reform, PBM of the middleman. The president has spoken about middleman and made comments here recently about middleman and how they're not bringing any value to the healthcare system, but they're driving costs up. If you will recall, last session, we passed out of the Energy and Commerce Committee and out of the House of Representatives the Lower Cost, More Transparency Act, and we were able to get that passed, and that included a number of reforms to PBMs, a number of reforms to price transparency, which is extremely important.
I'm curious, a lot of these ideas seem like Republicans and Democrats, as you just said, would seemingly be on board with them. How much bipartisanship have you seen in some of these, ideas, like with PBMs, for example? Is there room to work more with Democrats on this issue?
Question about it. The Lower Cost, More Transparency Act passed out of the Energy and Commerce Committee unanimously. It had Republican and Democratic support, and I think that was significant. I would submit to you that when it comes to PBM reform, we have some Democrats who are as passionate as Republicans are about that issue. Everyone has a pharmacy. Pharmacies are the most accessible healthcare practitioners in America, and if we're going to have accessible health care, we've got to make sure that independent pharmacies continue to exist and that they're there. 87% of all Americans live within 5 miles of a pharmacy, making them, as I say, the most accessible healthcare professionals in America. That's why it's so vitally important that we make sure that they are able to sustain and that they continue, because accessibility, affordability, and quality of healthcare is what we're aiming to achieve here.
And you have such a unique perspective because you're a former pharmacist. I guess, how does that experience help you in, pushing through or, advocating for a number of these reforms? And, when it comes to some of these predatory practices we've talked about, which ones have you witnessed and which ones are, would you like to obviously prioritize tamping out?
First of all, I'm still a pharmacist. I still have my license. I'm not giving it up for this gig, that's for sure. But anyway, but no, I did practice pharmacy for many years, and I was the one who had to go to the counter and tell the senior citizen how much their medication was and watch them make a decision between buying their medication and paying for their groceries. I was the one who had to go tell the mother how much the antibiotic was for her child and watch her in tears as she tried to figure out how she was going to pay for that antibiotic. I set as my goal and to make sure that we did something about drug pricing. It was high for everyone. everyone. I never went to a counter and asked them, are you a Republican or a Democrat? All I knew is that prescription drugs were high and they need to come down, and we can bring them down if we have more competition. And that's what we're trying to achieve in the subcommittee, is more competition and making sure that we have transparency so that we can recognize where the problems are. I would submit to you, if we had more transparency in the healthcare system, not just in the drug pricing part of it, but in healthcare in general, that it would lead to lower costs for all patients.
I want to shift gears and talk about the maternal mortality rate. I know you co-sponsored a bill, the Preventing Maternal Deaths Reauthorization Act of 2025. Georgia, your home state's maternal mortality rate is among the worst in the country. How will this legislation help mothers in Georgia and across the country?
Well, first of all, you're absolutely right. Maternal mortality is something that I've worked on ever since I was in the Georgia State Legislature, and it's baffled me, and I continue to be baffled as to why Georgia's rate is so high. But nevertheless, there's something we've got to address, and we've got to have the materials and the information available to our healthcare practitioners so that they will know what to focus on in the states, and we want to make that data available to them, and that's one of the things that this bill would do. It is very important for us to address this. In the United States of America, it is unacceptable for us to have as high of a maternal mortality rate as we have. And for the state of Georgia, it's especially unacceptable.
So why has the United States, I guess, fallen so far behind when it comes to maternal mortality? I mean, we're one of the most wealthiest countries in the world, if not the wealthiest. I mean, that seems pretty shocking.
And I agree with you, and it's something that, as I say, that I haven't been able to wrap my arms around and figure out why this is such a problem. It's maybe reporting is better here. I would agree with that, and maybe it's better in the state of Georgia. We are home to the CDC, and a lot of people say, well, you have better reporting there. Well, I still can't accept that as the total answer. Perhaps it does add to it, but we've got a problem. We got a problem here in America. We got a problem in the state of Georgia, and it needs to be addressed. And again, it's unacceptable for as you pointed out, one of the wealthiest country in the world to have these high rates.
I want to switch gears to another issue that, elicits bipartisan outrage as well, and that's the fentanyl epidemic in this country. You're the co-sponsor of the Halt Fentanyl Act. What does this legislation do in a nutshell, essentially?
Well, the Halt Fentanyl Act, which passed the House, and it is very important because it permanently schedules fentanyl and its analogs as a Schedule I drug, which means that the penalties that will go along with that will be more severe. And this is something that we had it temporarily scheduled, but it needs to be permanently scheduled, and we did that. And I applaud all of those who had a part in this. Look, fentanyl is infesting all of our communities. It is not discriminatory against anyone, whether it be a party or whether it be what color the skin you have. It doesn't matter. It is killing our citizens. It is poisoning our citizens. And I had a very, very unfortunate experience. I was in a public hearing, and being a healthcare professional, I should know better, but I referred to it as fentanyl addiction. And a mother stood up and corrected me, as she should have, and she said, "No, sir, you're wrong. My son took one pill and he's dead. It's fentanyl poisoning." And she was right and I was wrong.
That's interesting because I hear it referred to so many times by so many people as fentanyl addiction. What do you think is being done to educate Americans on this and how it is poisoning?
Well, that's a great question, and that's something that we need to be working on. First of all, we need to secure our border. I applaud the Trump administration. We've gotten the most secure border that we've had in many years now. And everybody thinks when you secure the border, you're just talking about keeping illegals from coming across that border. But it's the flow of those drugs across that border that is investing in our communities. That's one thing. Now, the educational part of it is also very important, making sure that we have have the tools available to let people know that, even one pill, a minuscule amount of fentanyl can be lethal and can kill someone. We've got legislation that we've got before us now, Sammy's Law, which would help us to have a tool in the tool chest on the internet so that we could identify certain words that would help parents understand and identify whether their child was involved in something like this before. So many of these drugs come off the internet, and you don't know what they contain, and in many cases they contain fentanyl.
I want to jump back to PBMs. I know it's a topic you're certainly an expert in. I guess if you could delve more into how PBM reform could drive competition and lower drug costs in the long term.
Well, right now, what we have is vertical integration, where the insurance company owns the PBM, that owns the group purchasing organization, that owns the pharmacy, that owns the doctor. And we've got to bust that up. And if we can bust that up, if we can have PBMs that are not owned by the insurance company and that don't own their own pharmacy so that they're steering patients to that pharmacy, then we can have an impact and we can have more transparency as well as having lower prices. Because right now, they're getting rebates. These companies are getting rebates, and they're simply pocketing those rebates. Those rebates need to be passed on to the patient so that the patient would pay lower costs for their drugs. That's the way that we can solve this problem.
So when we look to the Protecting Patients Against PBM Abuses Act, what needs to be done in order to pass that legislation ultimately?
Well, we have a commitment from the speaker and from leadership that these bills, that we had 4 PBM bills that were in the CR package back in December that unfortunately got pulled and that and didn't go into effect. We have a commitment from the speaker that those will be put into the reconciliation bill. They will save us some money that can be used as pay-fors. They'll save the federal government some money, but this will be an opportunity for us to get true PBM reform. It is not the end. It is only the beginning of PBM reform.
Speaking of PBM reform, and finally, Congressman, last year you sent a letter to the Department of Justice calling for an investigation into PBMs in the opioid crisis. Just wanted to get a sense of where the status of that investigation is.
Right now, the FTC, the Federal Trade Commission, is undergoing what they refer to as a 6B study to see the impact of PBMs on independent retail pharmacies. They've already come out with 2 interim reports, and hopefully will come out with the final report soon. We've been in touch with the new chair of the FTC, and he has assured us that this is one of his top priorities, and he's going to continue to have the FTC Commission look at this. We look forward with great anticipation to their final report so that we can get it to the Department of Justice, and the Department of Justice then will have the ability to do something about it.
Finally, Congressman, when it comes to, I guess, your work as a pharmacist and, drug costs and hearing about those drug costs from patients, I guess, do you have any particular anecdotes that come to mind, from your time working as a pharmacist about the costs of drugs and how Americans are, if they're facing challenges getting the medications they need?
Are facing challenges, and in many cases it's because of the PBMs not allowing them to get the medications they need. We need reform to the prior approval process. We need to streamline that, make it quicker and more efficient so that patients don't have to wait on their drugs. We need to make sure that that when a particular drug is ordered, that patient can get that drug. We need to look at a number of different programs. I would be remiss if I didn't mention the 340B program at this point. That's a program that has gone amok and that has evolved into something that it was never intended to be. It's a vital program for FQHCs, for federal qualified health centers, and for rural hospitals, but it has really gotten and grown to a point where it needs to be reformed again, and we need more transparency in it.
Congressman Buddy Carter, thank you so much for joining us today.
Thank you.